Oh, I think recently we've done a nice job of raising awareness about newborn screening. Now we screen for the possibility of babies having SMA in all 50 states, which is a huge accomplishment. But this still leaves an estimated 5% of children being undiagnosed through the newborn screening program. And those children will be diagnosed based on symptoms. So we do still need clinicians to be thinking about the possibility of spinal muscular atrophy in a child who is presenting with weakness. So that's something that we probably need to make sure that we bring to the forefront. It's been really an exciting time in clinical research, but our job is not done yet. So I think we're doing a great job of highlighting the progress that we've made, but we still require comprehensive multidisciplinary care and ongoing efforts to really optimize the outcomes of the kids that we're seeing and the adults that we're seeing impacted by SMA.
Yeah, I know newborn screening has obviously come a long way over the last 5 to 10 years or so, but I'm also curious from your perspective, SMA is a little bit different than other neurologic disorders in that the days and the time really, really does matter, especially for sort of early infants with SMA. So talk a little bit about ways in which we can improve the process of actually screening patients early on, and also not just screening, but getting them the actual care that they need in the treatments that they need in a timely fashion, considering the fact that obviously days and weeks very much matter to these patients. So talk a little bit about improving that efficiency process per se.
It's important and critical that we recognize that every day that a child with SMA goes untreated is a day where we could potentially be losing very valuable motor neurons. And those motor neurons can impact the long-term functional impacts of our patients. And so, if we want to optimize their long-term motor function, their abilities overall, their capacity for independence and gaining skills, then the goal would be to treat as soon as possible. Barriers to that are numerous. So even if we have newborn screening in place, we know that there can be a delay in getting samples to the lab. There can be different processing times that different states' labs have. So you may have one lab in one state that processes on a daily basis, and you may have another state that batches their tests together. And this can impact the timing of those results getting to the clinician. And then once we get those tests, we also need to make sure that we're confirming those tests. So usually that means a secondary test that ultimately confirms the patient's diagnosis and oftentimes will give us the SMN2 copy number, which can play a role in some of the opportunities we might present to them, whether it be a commercially available treatment or a research protocol that they can enter into. The next step is obviously authorizing treatment after you've prescribed it, and then getting that treatment shipped to the location where you're going to be providing it. So each of these steps along the way can prove to be a barrier to timely treatment. And so if we examine each of these closely, we'll be able to hopefully cut down on the time it takes from diagnosis to intervention.